Question 291. The correct sequence for abdominal assessment is A. Inspection, percussion, palpation, auscultation. B. Inspection, auscultation, palpation, percussion. C. Inspection, palpation, auscultation, percussion. D. Inspection, percussion, auscultation, palpation. Question 291. Answer: B. Inspection, auscultation, palpation, percussion. Question 291. Explanation: auscultation is done before palpation to avoid stimulating peristaltic movements and distorting auscultatory sounds. Question 292. Peritonitis can occur as a complication of A. Septicemia. B. Multiple organ failure. C. Hypovolemic shock. D. Peptic ulcer disease. Question 292. Answer: D. Peptic ulcer disease. Question 292. Explanation: perforation is a life-threatening complication of peptic ulcer disease and can result in peritonitis. Question 293. A patient has become very depressed postoperatively after receiving colostomy for GI cancer. He does not participate in his colostomy care or look at the stoma. An appropriate nursing diagnosis for this situation is A. Ineffective individual coping. B. Knowledge deficit. C. Impaired adjustment. D. Anxiety. Question 293. Answer: A. Ineffective individual coping. Question 293. Explanation: the patient is dealing with a disturbance in self-concept and difficulty coping with the newly established stoma. Question 294. Patients with esophageal varices would reveal the following assessment: A. Increased blood pressure. B. Increased heart rate. C. Decreased respiratory rate. D. Increased urinary output. Question 294. Answer: B. Increased heart rate. Question 294. Explanation: tachycardia is an early sign of compensation for patients with esophageal varices. Question 295. The nurse would anticipate using which medication if sclerotherapy has not been used? A. Neomycin. B. Propranolol. C. Vasopressin. D. Cimetidine. Question 295. Answer: C. Vasopressin. Question 295. Explanation: vasopressin is the drug of choice when sclerotherapy is contraindicated. Neomycin is used in preventing encephalopathy when blood is broken down. Propranolol may or may not be used to decrease cardiac output and hepatic venous pressure. Question 296. The nurse must be alert for complications with Sangstein-Blakemore intubation including A. Pulmonary obstruction. B. Pericardiectomy syndrome. C. Pulmonary embolization. D. Cor pulmonale. Question 296. Answer: a pulmonary obstruction. Question 296. Explanation: rupture or deflation of the balloon could result in upper airway obstruction. The other choices are not related to the tube. Question 297. Peptic ulcer disease may be caused by which of the following? A. Helicobacter pylori. B. Clostridium difficile. C. Candida albicans. D. Staphylococcus aureus. Question 297. Answer: a Helicobacter pylori. Question 297. Explanation: Helicobacter pylori is considered to be the major cause of ulcer formation. Other choices are not related to ulcer formation. Question 298. Pain control with peptic ulcer disease includes all of the following except A. Promoting physical and emotional rest. B. Identifying stressful situations. C. Eating meals when desired. D. Administering medications that decrease gastric acidity. Question 298. Answer: C. Eating meals when desired. Question 298. Explanation: meals should be regularly spaced in a relaxed environment. Choices A, B, and D are proper interventions in providing pain control. Question 299. Nitrosacarcinogen production can be inhibited with intake of A. Vitamin C. B. Vitamin E. C. Carbohydrates. D. Fiber. Question 299 Answer: a vitamin C. Question 299 Explanation: Vitamin C and refrigeration of foods inhibit nitrosacarcinogen. Question 300. The nurse can expect a 60-year-old patient with ischemic bowel to report a history of A. Diabetes mellitus. B. Asthma. C. Addison's disease. D. Cancer of the bowel. Question 300 Answer: a diabetes mellitus. Question 300 Explanation: Ischemic bowel occurs in patient over 50 with a history of diabetes mellitus.